Good morning. I'm Janie Parrish with the Wadsworth Area Chamber of Commerce, and you're zooming into business today, and you're zooming right into the Medina County Health Department Health Center with Eleni. And I'm going to have Eleni say her last name because amazingly, I counted and there are 16 letters in her last name. So no matter how much she worked with me, I'd never get it right. So Eleni, what's your last name?
Manousogiannakis.
So you can understand why I wouldn't have gotten that. And that's Greek.
It is, yep.
Yeah. So as I'm sure you've heard it before, you can say, well, that's all Greek to me.
And I would actually understand it. Yep.
Okay, good. Well, let's get going. Okay, first of all, tell us about the Medina County Health Department Health Center.
Sure. So the Health Center is a division within the Medina County Health Department. We have two locations, our original one in Medina on Ledgewood across Walmart. And Janie, as you know, and hopefully folks who are watching and listening to this Zoom are also aware, we have a Wadsworth location that we opened in January of last year. It's inside the Summa Rittman Medical Office building on the second floor, Suite C. And then in March of 2020, COVID hit. So it's been a little more slow going there than we would like, but we are committed to staying in the Wadsworth community with a physical presence. So we hope to see that volume pick up as more people know that we are available in the depth and breadth of our services. We as a health center really take care of people from cradle to grave, as you will. So we'll see women who are pregnant up to 28 weeks. We will then take care of the babies after delivery for their well-child visit checks, and we'll take care of kids through their teen years, adults, and through seniors. We have both medical and dental available at our Medina location. Medical is available in our Wadsworth location. We have a physician and a nurse practitioner, both are family practice providers, and we have several dentists as well. So we are a primary care office, similar to some of the private practice and group practices out there in the communities. We see people with and without insurance. Our target population is the underserved and uninsured, Medicaid, Medicare, but we will take employer-sponsored plans that we are in network with. As a federally qualified health center, we have the luxury of being able to take people from in-county and out of county. And I'll explain a little bit more about that term, federally qualified health center. Some people may wonder how the health center came to be. Now, the health department regularly conducts community needs assessments, and the one they did about 7 or 8 years ago indicated that there was a lack of access to primary care for residents in the county, and that there were about 58,000 low-income residents. Now, with COVID and job loss, that's probably more, and so we anticipate more people may have made choices to pay utility bills or keep kids in certain schools rather than taking care of themselves and their health, especially from that prevention aspect. Maybe if the tooth hurt really bad or they had a pain in their stomach that wouldn't go away, but that routine and regular care to keep folks on that track to well-being may be derailed at this point in our environment. So we are a one-stop shop. On the medical side, our physician does help people with opioid use and abuse through our medication-assisted therapy with the Vivitrol injections. We do pre-exposure prophylaxis for HIV, and I'm pleased to share that we have our first ever social worker. So she's available for cognitive behavioral therapy and case management, and she also helps people with enrolling in health insurance for Medicaid or Medicare and helping navigate through the marketplace options, which are available now through middle of May. So if anyone has questions on what they might be able to do, feel free to reach out. What else do we do? We do a lot, and you can see that we've moved beyond the traditional offerings of a health department on the clinical side. People may know us as a place to get their shots during flu season or for back to school, or maybe where I go get my pregnancy test or STD screenings that I don't want anyone else to know about, not even my own physician, or those physicals that are needed for work or school, but folks can't get into their doctor's offices quickly enough to get the paperwork signed. So we've really moved since 2016 to be a primary care facility to serve folks in the community and surrounding areas, and we really don't turn anybody away. I had mentioned.
Oh, I'm sorry. Go ahead,
Oh,
Eleni.
that's okay. I'd mentioned I'd share what the federally qualified health center means, and there are two things that I think really make us unique than other private practices or group practices or community clinics, and that's the following. One is that we have discounts available based on family size and income, and the other is that the majority of our health center board members are people who receive services at the health center. So we keep the community perspective at the forefront with our strategic planning decisions and where we really see the health centers going in both our Medina and Wadsworth locations.
Boy, what a gem.
Board members, Jeannie, if anyone's interested, they can reach out for sure.
I wanted to ask you, Eleni, why do you love what you do?
You know, I really, the mission of the federally qualified health centers really resonates with me on so many levels. I can give a usual answer of enjoy helping people, right? But there's so much more satisfaction that I get from working in organizations that address the socioeconomic factors at the same time as the physical and mental health well-being of people. And doing that in a public health department such as this only adds and amplifies that.
Wow. So tell us, how can people find you?
So we are available for appointments, and we have both in-person availability as well as telehealth for people who are more comfortable staying at home right now. And appointments can be made by calling our main line. That's area code 330-723-9688, option 1. And then we have information on the services that I shared today on our website at www.medinahealth.org. I think I said 3 W's, right?
I think you did. Yeah. Well, Eleni, I just keep cutting you off, and I so apologize, but I just wanted to thank you and all the staff at the Medina County Health Department. Whoopsie, you can probably hear my phone ringing. I forgot to put it on Do Not Disturb. But anyways, thank you for all that you have all done during this pandemic. I don't know what we would have done without our Medina County Health Department during this time. We have relied so seriously on the information that's coming out of the health department.
Well, that's what we're here for, so thank you.
Well, thank you for all that you do and everyone else. And it's been a treat to talk to you. Yeah.
Likewise.
Even though I know a lot about the health department because I had worked there my first job out of college, but it's still amazing to me, all the services that the health department provides. So thank you, Eleni.
Thank you.